Skeletal system. Why do some people have extra ribs? Imagine walking around and noticing someone has an extra set of ribs. It might seem unusual, but it's actually a common variation in human anatomy. Some people develop extra ribs, and this happens because of differences in how the body forms during early development. During fetal growth, the bones of the ribs are created based on instructions from genes called Hox genes. These genes tell the body where to place bones along the spine. Sometimes, mutations or changes in these genes cause the body to grow additional ribs in places where they normally wouldn't be. The most common extra ribs are called cervical ribs. These develop from the 7th cervical vertebra, which is normally in the neck area. About 1% of people have these ribs, and they are more often found in women. These extra ribs can sometimes press on nerves or blood vessels near the neck and shoulder, causing issues like nerve pain or blood flow problems. Another type of extra rib is called a lumbar rib. These form from the first lumbar vertebra in the lower back. Lumbar ribs are less common but also part of the natural variation in how our skeleton develops. Extra ribs can also be influenced by environmental factors during pregnancy. If the mother's health is affected, or if she is exposed to harmful substances, it can interfere with normal bone formation. However, genetics are the main reason for these extra ribs. In the context of the axial skeleton, which includes the skull, vertebral column, and ribs, having extra ribs means the typical pattern of 12 pairs of ribs is extended. Normally, humans have 12 pairs of ribs attached to the thoracic vertebrae, but extra ribs add to this count. Doctors often find these extra ribs through X-ray images, especially if someone has symptoms like nerve or blood vessel compression. Knowing about these variations helps in diagnosing and planning treatment for related problems. In summary, extra ribs happen because of genetic changes that affect how the bones develop along the central part of the skeleton. Sometimes environmental factors during pregnancy can also play a role. These extra ribs are just normal variations in human anatomy that can be harmless or sometimes cause health issues depending on their size and position.